So here's a brief introduction to bleeding using a 3-edged needle, sometimes called bloodletting. So I've already chosen a couple of spots that are good because they are on superficial veins, close to the surface. This one is a little bit over the bone, so that might be a little bit more uncomfortable for a patient. So I'm going to start on this one. So the first thing you do is explain what you're going to do and why you're doing it with the patient. And obviously, since I'm working on myself and I'm not working on someone else, I'm not wearing gloves, so make sure you do wear gloves. I've got a little bit of iodine solution over the area. And this is what a 3-edged needle looks like. Okay. As you can see, it is beveled. Maybe you can't see that on the video, but it is beveled. And so what you're doing is you're bringing your fingertips as close to the tip as you can without endangering of touching the skin. And you're going to be using a rolling motion, which is like this. On the very rare off chance that there is a little bit of spray from the vessel, you want to make sure you're moving your hand this way with the top of the needle moving towards you. So if there is a little bit of spray, which again is very rare, it will go out away from you and not, if you did it this way, up towards your face. So you don't want to be doing that. So you clean the area, you stretch the skin, and you're not jabbing, you're not puncturing like that. Again, it's an insertion while you're doing a rolling motion. So here we go. And that didn't quite go deep enough. I'm going to do another one real quick. There we go. Okay. Now it's going here. That one went pretty fast. Yeah, that second one really did the trick. So I'm letting the blood flow. I'm not in any hurry to stop it right away. As you can see, it's a little bit dark. I'm just going to give that a chance to slow down and end on its own. And this was not painful. So while I could feel a little bit of a stick, it really wasn't that bad. But you can see quite a bit is coming out. And that's probably because, one, this vein was very close to the surface, and two, I'm a relatively more yang constitution. So people who are more prone to heat, and this is along the Yang Ming channel, people who are a little more prone to heat, which is going to expand the blood in the vessel, that might contribute to the blood coming out like that. Okay. Yeah, so now it's starting to slow down a little bit. Now this is why you need to be wearing gloves when you're working on someone else. You can see even on a small spot, sometimes quite a bit of blood will emerge. And then when it's almost done, when it's slowing to a trickle like this, that's when I'll apply some pressure. So this only takes a few minutes. This is actually something that's really good for men to do. Since we don't menstruate, we don't lose blood. This is a good way of clearing heat, clearing toxins in the system. And as you can see, with just a little bit of pressure, the bleeding has stopped.